I didn't even look at the hours, I was just looking at the.
Yeah.
It is.
Yeah, you was behind, get her started.
We go ahead and get the audio started.
Yeah, go and start there. All right, we'll call the meeting to order. We have a quorum. Everybody got a chance to look at the minutes from last time? Any changes that we need to be made?
Hey, we're.
See any? Is there a motion to approve? Motion. Second by Dr. Anderson. All in favor? Aye. All right, they will come around to sign if you were here. Do we have any wishes to be heard in the crowd? Not seeing none. Introduction of staff. Start there. Hey, David.
So Jordan Walter just joined us, Secretary for Environmental Health for Foods and Rules. You wanna say anything? Nobody else will pass to you.
10-minute speech. So anything?
Yeah.
Welcome.
And then Brooke.
Hi, Brooke.
You just
I'll be right here.
Hi, this is Brooke Cummins. She's my new on-site inspector. Really happy to have her. We'll get her trained up over the winter, certified, and hopefully feet on the ground come July, August next year for septic season. She just started last week. Comes from the state doing.
I was in the immunizations division for 3 years at IDOH.
Welcome.
And then I'm gonna pick on Reagan a little bit too. She's not new to our team, but hasn't been to a health board meeting, so just wanna introduce her.
I'm Reagan. My last name's Shrezinska, but I won't make you pronounce it. And I do the secretary work for well and septic and also for body modifications.
Unfinished business, the infectious disease update.
Yeah, I was gonna say, I will keep this pretty brief because there's not a whole lot to update, thankfully, yet. COVID cases, we're seeing about 2 per day in the county right now, which is very low numbers. Wastewater levels as low as they've been all year. So, just keep knocking on wood. Nobody in the HRH anyways with flu, COVID, or RSV currently. So lots of good news. I think we're just kind of in full prevention mode, knowing that winter is coming. I have a feeling my infectious disease update will be more exciting in January. Yes, just one little tidbit, just kind of starting to get towards the end of the year for infectious disease. So we had, over the course of 2025, we had 15 Hendricks County flu deaths, and we had 9 COVID deaths. So just to give you some idea of where kind of flu and COVID are, I would say, I didn't get all the demographics on the flu deaths, but I think that's, pretty. It was a rough flu season last year, so we're usually around 5-ish. So it was a rougher year than usual. The COVID deaths, I think, have kind of converted over to the populations of the kind of the most frail. We do still keep track of that. Most of those people are 80 plus and have many comorbidities. But yeah, just so you kind of know where kind of the severity of flu and COVID. I'd say the hospitalizations between flu and COVID we'll see what this winter brings, but they were pretty similar over the course of the year, so they're very comparable when it comes to severity. But other than that, that's all I have for infectious diseases. Thankfully, pretty low right now.
Does the health department still have, maybe Ann, you may know this, do you guys still have COVID tests remaining, or are they all gone?
All gone, and we check pretty regularly to see if we can get more, and I don't think they're gonna bring them back.
Because they are expensive at the pharmacy. Whoa, okay. Just wondered if you could tell people you guys had something.
Questions? Yes.
All right, new business. The community awards update.
I was gonna cover that as well. Basically, I think three times this year, we met with our community awards team, and tip of the cap to Larry for serving on that. So thank you, and Mr. Harden also helping us out with that. Many of these fine individuals in the parts of the health department are there as well. But yeah, I think it's just important for you guys to hear what we're doing, because it's a substantial amount of kind of Health First Indiana funds kind of getting pushed back out into the community. So just wanted to, we last met, I didn't check the date on that, about six weeks ago, somewhere around there, 2 months ago, somewhere around there. Basically, just looking at some of the things we were doing through the community, there was like a $5,000 grant with Purdue Extension, doing some different trainings such as dining with diabetes, heart smart training, different type of dietary programs. There's a Matter of Balance program for elderly so these programs are, different lengths. It often meets, I don't know, depends on which program it is, but once or twice a week, and it's a pretty good program. They've come to us before, but to keep these trainings in the community, are really good. Probably slightly more unique. We also funded some workbooks that go to mothers in the labor and delivery suites, and they're going to be basically it's basically headed by some labor and delivery team RNs that created this locally, and they wanted to give everybody in 2026 one of these workbooks to focus on mother mental health, infant care, obviously infant feeding, making sure kind of finding yourself again, these kinds of different parts of this workbook. Like I said, I don't have the workbook with me, but you'll probably start seeing these in some of your labor and delivery. The providers will probably start seeing the moms bringing these in. I think it's a good idea, especially the focus on mental health. Seems like a nice angle for obviously a very stressful time in a family's life when you have these cute new little lives that you are now in charge of, and obviously different families have different degrees of stress depending on where their situation starts. So that was we put $50,000 towards that. So it's quite a nice program. And then through IU West, they are hiring basically a part-time person to help with community screenings. So basically going into some of these health fairs that are already existing, they're looking at 2 or more community screenings per month, trying to screen for blood pressure, A1C, cholesterol, trying to catch problems before they become larger problems, and then obviously if they see problems, then try to get these people into the healthcare system. We've kind of helped to fund a 2-year program for them. Everything from mileage to some of the equipment they need, and then the part-time FTE. So that was about $150,000 that we put towards that program. And then probably our largest program that's this last group, basically Hope Healthcare is looking to expand their dental program. For the longest time, they were trying to do it with volunteers, and it's just not working. They've got the equipment, they got the chairs, they got everything. They're just empty rooms right now. So they're basically over the next couple of years going to about 2 to 3 days per week. I don't remember the specifics, but basically have a part-time dentist, a dental assistant. I think Larry does more in Larry's world than mine, but yeah, a couple people to help said dentist to be more efficient. But But I think, you know, if any of you have been, you know, exposed to healthcare at all, this is a common phone call I get, is tooth gone bad, can you call me in some antibiotics? And I'm sure these folks are going to the ERs, the immediate cares, not getting the care they need. The vast majority of these folks are kind of, you know, in that underinsured, you know, population. It's not, you know, these folks just wouldn't be able to afford this any other way. So yeah, that was, so we're helping to fund basically that team for the next couple of years, and that was a little over $400,000. So yeah, over the past couple years of doing these kinds of programs, we've put back into the community just over $2 million through Health First Indiana. It was just a little taste of what we did, you know, a couple months ago. But yeah, I mean, it's exciting work. I mean, and one of the favorite things I get to do, really ever, you know, is to try to help out the community and hear about these needs and hear about these projects. It's really great to be a part of. So, but yeah, I think it's important for you to hear what we're doing with Health First Indiana Fund. That, you know, it's a good portion of them. It's not all we do with it, but you know, you may start hearing, you know, as we start looking forward to maybe going, you know, that next budget cycle's not too far away. You know, we will once again try to bump up the Health First Indiana funds, and you know, but these are the ways that those funds are helping our community. So I wanted to make sure that you guys are well aware of what we're doing with them. I don't know if anything else to add, Krista. I think it's.
That was a good code. Yeah, that was the fourth round that we had last time, so. Contracts, some of them will be, the first contracts are ending the end of this month. And then we have a range of contracts that go, some of these will be through December of 2027. So they just kind of are phased in differently depending on the program and what they need. But yeah, excited about all the work that's being done.
I know there are a lot of cuts to that funding down the road. Still, there will be some funding to continue these kind of projects, obviously, even hopefully even beyond 27, you think?
Yeah, it'll be.
Yeah, obviously was the.
Yeah, it'll be substantially less moving forward, you know, somewhat sadly, but we will make do with what we have. But but yeah, I mean, like I said, these are really exciting projects, especially kind of that larger investment in dental care for our community. I hope healthcare is well established. I think that will really help a lot of people.
I was in this round especially, I felt like we were funding programs and projects that were focusing on underserved areas of the county. You know, whether that be the IU health program, because they were going to focus some of the smaller communities in the western part of the county, to the Hope Healthcare, which it's as a layman, it's interesting to find all the health problems that can stem from not having proper dental care. So I was impressed with it, and yes, Drew, I would say Health First Indiana was the priority of the last administration, and that's not the priority of this current administration. So if you think it's important, be sure to mention that to your representatives both in the Indiana House and the Senate downtown. So,
I was just going to say too, I volunteered at Hope Clinic for years, one day a month, which a lot of my colleagues did, but it's just really hard to get any continuity, any working together with assistants and such, just because you have so many different people there. It was hard to provide really good care. So I think it's good to be able to get somebody in there. I think it now will be like a federal qualified health care organization, which the students can use to get discounts off their student loans. So it's kind of a win-win. I talked to the guy, I can't think of his name now, the new guy that's in charge. It was John Milan, but Because we wanted to try to get students to go out there and volunteer, but it boiled down to liability, and we couldn't, whose license are they gonna be working under and that kind of thing, so it just didn't work.
That's great. That's all I had.
Well, there's an empty seat on this board now, so are you the one that we're talking to about this? Or the criteria, or David, have you, as far as appointing another health board
Yeah,
member?
so we've submitted 3 appointment forms, so 2 are reappointments. Tim Campbell and Brian Cobb are both being requesting that they be reappointed. Yes, that's the commissioners, but we did send those requests. And then we sent a request for Kent Elliott. He's a professional engineer with Banning Engineering. So we have that request submitted as well. So when they do those appointments, we'll be on the agenda for the commissioners to have those approved.
From the proper
Yes.
demographic and all the new rules that we have to follow.
How long does that process take for approval or projects?
I would assume we'll know in the next, I would assume before December 1st, I would guess, but.
Yeah, we left usually we fill in which agenda we would like to be on, and I left that open because I do a lot of appointments all at the same time at the end of the year, so kind of let that be scheduled by the commissioners, but yeah, they usually do that by the end of the year so that they're ready to go in January.
The initial feelings toward the commissioner vibes, I guess, towards Ken Elliott's are very strong. I'll put it that way. So I think I hopefully like our chances there. You know, and obviously these two have been doing an incredible job. You know, I mean they're well aware. So we expect to go pretty smoothly, but yeah, they both Commissioner Gentry and goodness gracious, Commissioner Wicker both know Ken quite well. So,
Speaking of January, do we have the dates for next year's meetings?
No, that would have been great to have.
Maybe we get January's on the agenda.
Yeah.
Decide on January's,
Yeah,
and then we'll come
that's good
back.
thinking.
We can look at
That's an excellent.
go at the end here.
Yeah, we'll let Lisa go, kind of go through the updates here. There she goes.
Yeah, I really don't have a whole lot to update. Sarah Dallas, one of our food inspectors, is going through standardization training with the State Department of Health. The state usually only standardizes 1 person per office, but in order for them to meet their requirements, they needed a couple other candidates. So Sarah was able to be one of those people, which is exciting to have 2 of us that are standardized now. We're attending some training tomorrow put on by the State Department of Health at the MAID Center. So it's an all-day training that food staff will be attending. And other than that, it's just the day-to-day stuff with inspections. Temporaries are still going on. I'm amazed at the amount of calls I get about farmers markets and home-based vendors that still have questions. I just did an inspection before tonight's meeting because we have several different winter farmers markets that are going on. So those calls are still coming in, but otherwise everything's going well. We don't have anybody in habitual non-compliance currently.
All right, Kristen.
All right, we are still very deep into septic season. We got a late start this year, mid-July, I think. So we were concerned it was gonna be very short. We're still, we have inspections scheduled for brand new systems, going dug in tomorrow, which is bizarre for November, but we'll take it. The contractors are as excited that the season's still going, and we're happy to have the opportunity to train Brooke to get her out onto some of these job sites right now. We'll see. It's supposed to rain this weekend though, so I don't know. I don't know if you guys remember, but earlier this summer, there was a new technology approved in Indiana for pressurized ATL systems, which ATL, advanced treatment, no, that's wrong. Advanced treatment lines, that's wrong. I don't know. It's a brand of septic systems. It's a brand. And they were approved through the state back in May for pressure distribution. So they have a smaller square foot, so we've actually installed, the contractors have installed 4 in the county this year, and they're really useful on small lots that have failing septic systems. So these old subdivisions where we're getting like more and more requests for replacement systems, we've really been able to like utilize this new technology on those lots. I'm really hopeful for them. They seem to be easy-ish installs, so we'll see. But we were one of the first in the states to get it done, so we had the state come over and look at it, and then we had the ATL area rep come down and look at it. So kind of use some training, not just us learning and the contractors learning, but the state as well. So that was exciting.
So does that work like, does it pressurize the fingers and then it goes out faster and?
Yeah, so the ATL is like a foot long, it's a 4-inch corrugated pipe with slats in it surrounded by like peanuts essentially, and then wrapped in geotextile. And you need so many square foot per bedroom and per the soil loading rate. And then there's like a manifold, and then each line, usually on an ATL, it like snakes back and forth through the whole thing, but on a pressure system, there's a manifold. And so each line is getting pressure. So there's like an inch and a quarter or an inch and a half PVC that goes into that 4-inch corrugated pipe. And then we have like a larger pump than normal to pressurize everything to make sure there's enough pressure at the end of each line. So that way the whole site is getting treated at once rather than it like slowly trickling.
Yeah.
So the whole basal area is getting utilized, especially on those compromised sites already. So cool new technology. We get to use it, get to see the first few try it out.
What's the cost like?
Huh?
What's the cost for one of those compared to a traditional?
I don't really deal with cost aspects. I've seen a lot. It's a few tens of thousands, many tens of thousands. And honestly, that's gonna be contractor variable too, which is kind of weird. So occasionally I'll ask a contractor how much they're charging for a specific job site, but it's all over the place, which is why we always recommend that they get multiple quotes from multiple people. So yeah, other than that, Paul went to National On-Site Wastewater Recycling Association in Ohio for a week. In October, he took a bunch of courses, learned a bunch of things, kind of got to see what other states are utilizing technology, took some soils classes, ways to reduce in-home water usage. He came back and said it was informative and enjoyable and he liked it. That's it. Otherwise, we're just septic season. Still.
Deep into septic.
Deep into septic season, yes. There it is.
All right. Healthy bit.
So we just closed out the first year of our last contract extension. So we closed that out at the end of September. October 1 starts the last year of this extension. We were at 57% of pulling down our allocation. So DCS has communicated that next year, when we get closer to the end, they'll kind of make up for allocations, or we'll see how much we're on pace to pull everything down next year. So RFPs for the 2025, 2029 contract years is supposed to be out sometime in November. It was gonna be out in October, now it's November, so we're just kind of waiting around for that. We continue to have a huge increase in referrals. Our WIC referrals are really up. In our third quarter, we had 100 referrals, and we're only able to serve about 6 of those, just because of our caseload sizes. But we are making sure that those families get referred on to other programs. And our caseloads for language services is staying full. In fact, we're over right now with families that have interpreters. Other than that, we've participated in the coat drive in the county a couple weeks ago. We've been doing the All About Pregnancy events at the hospital. It's kind of a night when all the new moms come in and tour the hospital and kind of get a taste for what resources are in the county. And we've rolled out our holiday assistance program, so we are in the process of matching sponsors with all of our wish lists. So if anyone is interested, please let me know.
When again do you want the items to you?
December 12th, their drop-off date.
Nicole?
So we have started our walk-in clinics for flu and COVID, and
and we'll do those on Wednesdays from 8:30 to 3:30 through December. And we'll keep them through January, but we'll also open up some of our appointment times. So we started that with flu and then Moderna COVID only for private patients while we were waiting for the final guidance from the government on what we were allowed to do. But we have guidance on what we can do for our state vaccine now, so we can administer COVID vaccine to everyone. So anyone who wants it can come and get that. Right now we do have Moderna for private. And then so far we have given 562 flu vaccines and 126 COVIDs. And then the IIC hosted an immunization clinic for us on October 7th at the Maid Center, and they gave 234 vaccines to 63 people, so it helped get our kids that were gonna get excluded from schools. And I think you might have the vaccine bookmarks that Danielle put together. She worked with us on trying to figure out ways we can increase our immunization rates. So she's given 700 of those out so far, so 300 to IU West and HRH, and then 100 each to a couple pediatrician offices so far. And we'll keep strategizing other places to get those out to, but that was the start. That's all I got.
So Nicole, on the COVID vaccine, you said Moderna for private. What about is the Pfizer for?
So we will have the Pfizer probably next week. We have some Moderna that was gonna expire sooner, so we needed to get that used. Trying to cost effectively get things done, but we will have Pfizer as well, yes.
Arguments there. Thank you. Ann? Outreach.
I don't have a lot. We have had a very busy couple of months with events, and we are finally done with a lot of those events. October was heavy, a lot of trunk or treats, which normally feels like all we're doing is giving out candy, but I was surprised at the number of people that asked about flu shots and COVID shots and just, immunizations in general and some other things. So I would say it was a pretty successful, fall season for us. So right now we're mostly just planning for next year, trying to think about what things we want to tackle. We have been helping out with some vaccines. We have done some off-site clinics. Danielle's been organizing those. We went to Surter Sports. I don't know if any of you guys are familiar with Surter Sports. They have a warehouse up between Avon and Plainfield. They primarily make football helmets for the NFL. So I didn't even know it was there. It was very cool. So we did flu vaccines there. Today we did Brownsburg Meadows, the assisted living. I want to say we probably did approximately 60 residents, flu and COVID. So it was a good clinic day. And so we have time right now that we can do those and can help out. So we just kind of do them based on request. If we've got the staff, we're glad to help out. Danielle has been making the rounds at a lot of the Avon schools doing vision screens. I would love to be able to give you an exact number. She's vision screened hundreds of children. And she's been out about 3 days a week doing them. So I think right now it's mostly just Avon schools, but I think the other schools know that if they'd like us to come in, we'll definitely do that. We're getting a lot of help from our MRC volunteers to do those, so that's worked out well. But otherwise, that's about all I've got.
All right.
So as Ian had mentioned, we're starting to shift activities like wrap up end of year, start next year. You would have thought that would have been my clue for the calendar days.
I didn't think about it until we were sitting.
I do have those. I don't know how slowly you want to go through them, if you want to check dates or if you want to, how you want to do that. But so the first one I have is January 13th. And then March 10th. May 12th. July 14th. September 8th. And November 10th.
What was the first January?
13.
13.
1-3.
What was the March date?
10.
It's not an election.
May 12th, July 14, September 8th, and November 10th.
The July one is during the fair. So I don't know, you guys will have those going.
Move that up or back, or one way or the other.
Sometimes
September 8th is the day after Labor Day.
What have we done with, like, I know around July 4th, we moved the time of the
Yeah,
fast,
so
but
like this,
Labor Day, the
this
day
month
after-
we moved because next week's a holiday on Tuesday, it's Veterans Day. So usually if there's a holiday, we move it, or sometimes July's usually the one that people are taking vacations and that, so I think we tend to keep it and see what life is giving us when we get closer to it. But I don't know that it's been late enough where it's fallen in the fair before, because usually, I mean, this is the latest it can fall in July, so.
Well, the fair is
It's earlier, I think.
earlier the last couple of years, and they're gonna, everything revolves around when they can get the carnival.
Well, in school, Avon starts.
Well, yeah, that's always fun, cleaning up from the fair and then going back to school the next Wednesday.
They can be moved, certainly, if you
We get to it, we can,
Yeah.
okay. But everybody okay roughly with those dates? Any
Yeah.
major concerns?
At least we know the 13th is pretty good. For January.
January 13th, yeah.
The only one that I might have, at least currently have an issue with is what Eric mentioned about the fair, but that's it.
Can we get a motion to approve these dates for the meetings for next year? Because we do have to vote on that one, I believe, to approve those dates. So,
So moved.
I'll second.
second, okay. So that is voting to approve the January 13th, March 10th, May 12th, July 14th, September 8th, and November 10th meeting dates for 2026. All in favor?
Aye.
Okay, all right, those. All right, here we go. Yeah.
The only other update I was going to give, we did receive some feedback from Indiana Department of Health about how we track our Health First Indiana Community Awards. They would like to see it a little bit differently than our auditor's office does, which is fine, we can track both ways. So they do want us to report out if we have a contract, so we've awarded that dollar amount, put it in the year we award it, even if not all of it's paid out until subsequent years. So we usually don't give them all the money, depending on how large the contract is, we may spread it out during the lifetime of the contract. So for Indiana Department of Health, we're gonna track that with the year it's awarded, and for the auditor's office, the amount of money that's, as it's paid out, yeah. So that probably affects no one other than me, but just,
Another step.
if you see different reports that says like this much, we spent this much money, Health First Indiana, was encumbered because of contracts versus what was actually paid out, reports may not match up exactly, but depends on which viewpoint we're going.
All right. Anything else? Is that? Anything else for you, Dr. Stoppers?
Just briefly, you'll see some of our flyers and cards and things in front of you. That is going to be something that I'll be working on. So a couple weeks from now, I'll be in front of the HRH med staff for like 5 or 10 minutes, and I'm going to try to do my best impersonation of Michael going through the community resource guide on the projector over there at the fairgrounds for 5 minutes, just trying to show providers how it can be pretty useful, especially as we know about food stamps and, all the different food banks in the area and all the different, housing's a real thing and, all those kinds of things. I think that's a part of medicine that is very important. Obviously, we would love to get all the utilization out of the resource guide we can. Also, just showing patients the website and saying, hey, here's a resource for you to look through and, make some phone calls. It's got counseling and, all types of things, as you guys already saw. So, I'll be doing that in a couple weeks. I have some connections at IU West. I don't know if I'll be able to get in front of their physicians, but at least can get them information. AHN, I don't have any connections to. I don't know if you think of anyone for me to, maybe send some digital information to that, you can kind of help. I said, okay, all right, that would be great. If you can help us spread the word of, just the resource guide, if any offices are interested in anything like this. We don't want to just blast them out to everybody, but we want to make sure the physicians use them and not just kind of, throw them away as soon as we drop off 100 of them. So, and then obviously the STI clinic's got free testing, which I think a lot of providers would be very useful for providers as well. So I will send you some digital propaganda here soon. Yes, but yeah, I think and Krista said this before. We do so much great work. I think the one thing that we sometimes struggle is promoting what we do. So I really want to focus on that here for a bit and see if we can get more providers in the area to know these resources are available. So, anyways, that is all I have. Thanks.
Larry, any comments from the county council?
Not much. The council approved or passed the salary ordinance for next year. So assuming that we don't get any objection from the Department of Government Finance, which we don't expect, the salaries will be set. And I just wanted to add, discussion about the cut in funding from the state for health, all sorts of health services. And it's, we're suffering, but other counties are too. I'm active with the County Councils Association and on the Legislative Committee. We'll try to get additional funding this next year. So far, it appears that the state is going to have more money than was projected. I think the first quarter, they were up $250 million. I haven't heard anything since then. But next 2026 is not a budget year. So traditionally, they don't make any additional appropriations. We're hoping that'll be different this year since the cuts were drastic and a lot of pain as a result of those cuts. So we're gonna do what we can to get some of that funding restored. That's it.
I love the model though that money allows local health departments to be able to let people who are already doing the good work in your community and to support them. And it's not like you guys have to do it all. Like you can partner with other people and as long as we're reviewing them and people serving on board is to do that kind of stuff, like to say they actually are doing what they say they're doing and the money's getting used for the right things. It's a win-win for everybody. So yeah, government funding always can be used for a lot of wrong things too, right? Just get misappropriated about it. You guys do great oversight and targeting these groups. It's awesome. It's great.
We really have a great board for this program. Yeah, I mean it's an outstanding group of people we have making those decisions.
Eric, anything from?
We've been working through some affidavits for septic systems. I think that might have actually been the health board, the first one, and then we had another issue come up the past few days with a property had, like in 2004, something was noted on the property tax card, and the homeowner has complained, or the property owner, about what is on there. So we've been trying to work through figuring out how to put the right type of wording on the affidavit to get it actually recorded. Today I talked with the actually with the guy for about 30 seconds, and then I talked with his attorney, and I think we're in a pretty good spot with the language we've proposed. To the attorney seemed like he was pretty receptive to it, so.
Related to
It is, so it's a vacant property, and there's 2 lots in this subdivision at least that had a note on their property like if you look on Beacon and you click on your parcel, it'll have some notes off to the side. And it has that it says that the lot is undevelopable, you can't develop on it because that's essentially what it says. There's no sewer out there at this time. So the soil tests were not conducive to on-site septic. So, but nothing was, it does not appear at least, that anything was actually recorded. So if you're doing a title search, you're not finding it, but if you're looking on like the property tax records, it's on there. It's my belief, I don't have anything to say to have like any concrete evidence, but I'm assuming the previous owner of those parcels once he figured out he couldn't develop, he didn't want to pay all the property taxes, so he went to the assessors and then provided that the septic issue would not work, so they received a pretty considerable discount on their property taxes. But it doesn't sell well when you have something that says you can't build a house on it, so. I think that one is resolved, but we'll continue to see more and more of these people asking for like the secondary easement to be lifted from their properties. And so I expect we'll have more of those as people hear that they can have those removed off their parcels, but that's pretty much been the only issue we've had.
Thank you. Any other comments? Good to the order? Seeing none?
I would make a motion to adjourn.
All right, we are adjourned. Thank y'all.